Hello everyone and welcome to 2025 edition of the Global Public Health Week, an initiative of the World Federation of Public Health Association. My name is Marta Lomazzi. I'm the Chief Operating Officer of the World Federation of Public Health Association. And I'm really pleased to be here today to introduce few extracts of immunization webinar we have run during the last few months. This video we are going to listen is an extract about healthcare worker vaccination, from legislation to implementation, with a special focus on Tunisia. And we will listen from Professor Barbouche about the experience in his country, where legislation is present following WHO recommendation. However, there is a big gap between legislation and the implementation in the country. So let's listen from Professor Barbouche and try to see ways to implement from legislation to real life activities and make sure we protect healthcare workers in every country in the world through appropriate vaccination.
Thank you so much, Marta, for your kind introduction, and thank you for everyone for listening. So I will talk about the situation in Tunisia with regard, I will focus, on healthcare workers vaccination. All my talk will be around the healthcare worker vaccination. So what is clear with regard to healthcare worker vaccination, that legislation exists. The legislations are there, the recommended vaccination are there, provided by the WHO as a recommendation. But now between the legislation and the implementation of these recommendations, there's a gap. And this gap is the real problem today. And here I think that a lot is asked from the occupational medicine people. And this is a real difficulty because they have to decide what kind of vaccination would be mandatory, in which situation. For example, we know that people working for TB in our countries, for example, either in the labs or with patients, we will need to have a special algorithm for their testing, for skin test would preferably be positive. If not, they could be followed or at least vaccinated by BCG, which we know is not perfect for adult protection, far from that. So it's really sometimes a decision of the occupational medicine people, and this is very difficult. And this is right for many other situations, including for regular things like influenza and so on. It's not easy because there's a problem of cost, of the role, the real role, the definition of the real role of the occupational medicine doctors. They are not always keen to do this kind of vaccination. So there are many difficulties, and that's the real problem we should work on. What are the mechanisms by which we could improve the situation? Now, with regard to the situation, we do not have, in my country, in many countries from the EMRO region, from the East Mediterranean region, with a few exceptions, we've just heard now from Pakistan and probably from the Gulf area countries, there are some registries, but otherwise, in most of the country, there is no registry. There is no electronic registry neither, of course. So all what we have, data are very scarce. Very, very few data are available in the literature. And maybe I could mention a few of them for Tunisia. And these are, so no registry, so these are hospital-based series. So these are hospitals or medical institution or health institution which do this work just to see what is the situation in their settings. So this is, we cannot rely on such data to have a real figure at the national level, but nevertheless, that's all what we have. For example, for hepatitis B. Hepatitis B is one of the most recommended, of course, vaccination for healthcare workers. And fortunately, the situation is changing for hepatitis B because now the new generations that are coming to the work, to the workplace have been vaccinated through the EPI programs. But one of the studies I found in 2010, not so far ago, was conducted, a very serious one with thousands of healthcare workers included, showed that we have only 25% of the personnel which have been vaccinated. Only 25%. 4% have HBs antigen. So they are chronically infected, probably through their work or other place, we don't know. And so 70% of healthcare workers were candidate to vaccination. And this was before a campaign for vaccination against hepatitis B that was conducted in these big hospitals in a few towns in Tunisia. And I should say that the success of the campaign was fantastic, because 90% of the personnel adhered and to the vaccination. So it's not a problem of adherence or anything, but it's the dynamic of this vaccination, and the way we are doing it actively needs to be actively, and this is what is missing. For tetanus, for example, tetanus vaccination, only 22% of the healthcare workers are vaccinated. Because many of them would say, and there have been questionnaires for this personnel, we would say we are not aware that it is really a risk for us, or anything like this. So we need to make an effort in terms of improving awareness of these things among the healthcare workers, for sure. For influenza, for example, only 19% of healthcare workers are vaccinated, for many reasons, including the cost of the vaccines. The cost is very high, and institutions are not always keen to pay for that. So there should be a national effort, an organized effort to do things. And this is missing once again. So these are the areas where we should work really. For COVID-19, we had this epidemic, as all of you know, and I should say, well, once the vaccines were there, the adherence was fantastic. And most of the personnel have been vaccinated without any problem, but it was an active way to do it. So this is the difference. How we do these campaigns, this has been the beginning of the EPI programs, it was like this. But now we have a mechanism. And I think that this is our problem, really. We should work on that, in my opinion. And we need to do advocacy for a better, first, information of healthcare workers. And second, better vaccination programs. And this will not go through isolated action. It will go through only governmental actions. So the recommendation of WHO should be followed much more strictly. And the problem of budget, of financing this, has to be solved in one way or another. And finally, I think that in any initiative we would have through this program or other programs, we need to involve all stakeholders. There are many contributing to the potential success of this. I'm thinking about the NITAGs, which is not our role in NITAGs to do this, but could be. People are sensitized to this problem for healthcare workers, and could be a way to do it. I think to professional association for nurses particularly, and other professional associations for physicians and others, they should have their role. I think about the occupational medicine departments, which should be involved because they play a major role, as I've described earlier. And of course, we need to adapt things to locations. We cannot do everything everywhere. We are conscious of that. So we need to have priorities to classify our action in terms of higher priorities, which could be involving all countries, and less high priorities, which could be possible in some areas, but not in other areas. So this is my opinion about this, and I will be very happy to discuss with all of you and take any questions later. Thank you.